Don't go underwater with the coming tidal wave about to affect the healthcare industry from regulation and technology. Here's one clear strategy you can implement today so you can escape the destruction. This is coming at an enormous rate when it comes to healthcare organizations. Think about this: new technology, new regulations, new ways of practicing. It's becoming too much. Medical practices are closing down. Doctors are getting burnt out. Clinicians are just leaving and going to do other things. What about patients? Patients are suffering because they're not getting the help they need. There is an epidemic when it comes to healthcare right now, and there is one way to solve this opportunity. I know there's a lot of doom and gloom. Are you ready to kind of understand what the possibilities look like for your healthcare organization? If so, stay tuned because I'm going to break down how exactly you can be super successful coming here in the next couple of months. Let's get started. First, I'm going to talk about the technology changes. Yes, it's AI. Yes, we all know about that. But yeah, there are other things that are coming your way that you need to be prepared for. Second, I'm going to talk about the regulation changes. There were some recent laws that just got passed here in the United States that you need to be prepared for. What does that look like for you and your organization? And last but not least, I'm going to get into what clear action you can do. And it really involves investment. Yes, investment. We'll talk more about that in a second, but you really have to invest ahead of revenue. And we'll talk about that. My name is Theo Harvey. I'm a serial entrepreneur. I went from a lowly employee to a CEO of a multi-million-dollar healthcare organization that I run from my home. I raised $1 million from venture capitalists and from family and investors. And I work with large organizations like AT&T, Charles Barkley Organization, Blue Cross Blue Shield, and Google. I'm here today to kind of help healthcare professionals prepare for the new normal before it's too late. So let's talk a little bit about what technology changes are coming. Yes, AI is here. One of the big things that a lot of folks are talking about are what they call these ambient listening tools. What are those? Those are those tools that are listening in when you're talking to your patient and be able to code everything properly so you can bill for it, but more importantly, so you can look at your notes and review. Don't you think this AI is looking at this tool and looking at this data to determine how best you can provide clinical help? Yes, definitely look at these tools to kind of help you, augment you, and not replace you. Also, you have to learn new methods, right? They're doing things with their medical records, understanding about your patients and understanding what's happening with them, put them in different categories or buckets. Or we talked about this previously on this channel about stratification, right? Where you're looking at different ways you can look at the patient populations and treat them. So you want to understand how you can use technology to do predictive analytics to understand exactly how best to treat them. And so these tools can help you become a better practice, help you become a better professional, because they can enhance what you're already doing. This is a simple question I have to ask you. Are you using artificial intelligence in your practice? And if not, why? I think this is something that you have to do. I mean, every industry right now is being impacted by this. I have one simple thing you can do to get up to speed. It's very simple. You don't have to do much. We'll talk about it in a second, but let me give you some data first. A 2019 UK study suggested AI can replace up to 35% of jobs over the next 10 to 20 years. So that's why there's so much anxiety right now when it comes to this tool. We're hearing more and more folks embracing it and thinking it's better than anything. But there's problems with that. If as a domain expert, I guarantee you'll take this tool further than any person who's just going to Dr. Google to figure out what's wrong with them. And so this is something that you can take advantage of today. Bill Gates, big tech mogul, said that within the next decade, AI will make great medical advice almost universally acceptable. I think that's the case, right? We've seen the progression of this. Think about what happened before when it came to radiologists, right? There was teleradiology. Radiologists used to be in the hospital, right? Looking at the information and giving back the data of what the x-ray told them to the doctors. So they had the greatest information to help treat the patients. Then the technology with telehealth moved to teleradiology, where the radiologists were at home looking at the data, determine how best to treat the patients and calling in or sending in via the cloud. Now with artificial intelligence, it can now take this information from the x-ray and use artificial intelligence to do predictive analysis of what's happening with the patient based on thousands of cases of similar issues. And so I think this is something that we're going to see more of, right? Certain aspects that technology has impacted with care, some cases like outreach or clinical decision making can be outsourced to AI. So you have to learn these tools. Here's a fast way you can learn. This channel, this is what we're building it on, healthcare and AI. So we even did one specifically on AI and mental health, where we kind of walk why patients are looking at AI like ChatGPT to understand, talk to them as if it was a therapist. So go check out that video right here. Also, AI and talking about how it can be used to generate more revenue for you in your practice, understanding these new revenue models and how artificial intelligence can impact that. So go check out that video as well. These are some simple things you can do now to just get up to speed so you feel more comfortable, but also learn key instincts on what's happening out there so that you can be better prepared, just as if you would for any continuing education course. So go check those out, those resources, and let me know what you think about them. Next big change or tidal wave that's coming our way is regulation, specifically around Medicaid. Here in the United States, they just released the Big Beautiful Bill Act of 2025, and it has significant effect on federal taxes, credits, and deductions. And it was signed into law of July of 2025. So what's in it, especially when it comes to Medicaid? Significant cuts. So if you don't know, Medicaid is basically insurance at the state level. It's really targeted for patients who may not have resources to get traditional healthcare insurance, and it's basically state run. So every state runs it differently and they kind of allocate it differently, but it's really being impacted with this new bill, especially as well as what they call the Children's Health Insurance Program, which is just for healthcare for children. So what's happening here? Well, first of all, in this bill, we're going to see cuts like Medicaid and CHIP coverage for individuals who cannot promptly verify citizenship or immigration status will be removed. We're going to see states going to have to implement work and community engagement requirements or work requirements for patients and adults who don't have dependents. They're going to be required to work in order to qualify for continual insurance coverages. And last but not least, have a reduction of retroactive coverage. So basically, they're going to limit how far back they go to cover you for some of your health concerns. This is huge. And so what does that mean? A recent data, if you look at all the Medicaid patients, right, that's on the program, 78 million patients across the United States alone. Recent data from the Kaufman Family Institute, that this is a huge think tank. The estimate number of patients who will lose their Medicaid coverage is 7.8 million. That's roughly about 10% of the total Medicaid population. Question I want to ask you, how many patients do you have on Medicaid? And what if you lost 10% of that revenue to your practice? Let's do some simple math here. Average practice makes 15% margins when they deliver services to their patients. So what does that mean in practical numbers? For every $100 in revenue, you get back $15. Yeah, that's okay. It's not bad. Definitely could be more. And other industries have more, but that's decent. But with the loss of 10% in Medicaid revenue, you will only get to keep $5 for every $100 of Medicaid revenue you get. So that's a loss of about 67% of take-home money from Medicaid patients for you and your practice. What does that look like for you? How would that affect your organization and your practice for the future if you are having to lose this much in take-home pay, where over half, almost 2/3 of your revenue you were used to getting is gone now? This is a shame. Let's think back. I have a thought experiment for you. Think about last year. There was a recent clearinghouse organization called Change Healthcare, and they experienced a hack. Basically, clearinghouse is just a big warehouse, if you will, that takes all the claims, basically everything that was done for a patient, submits it into the clearinghouse. The clearinghouse cleans it up so it can be standardized in a certain format to send to the insurer, so the insurer can say, yes, this can get paid, and it sends it back out to the providers to get compensated for work they've already done. But Change Healthcare was one of the larger ones out there, and they got hacked by a group and basically said, hey, we're not going to release this information. You won't get access to it. We have access to patient data unless you pay us a ransom in Bitcoin. It was very controversial. What ended up happening, Change Healthcare just shut down everything. They could not process any claims for months. So how many independent practices suffer from this? I can tell you for a fact, tens of thousands of practices. Some of them I worked with were struggling to make ends meet. They had to get loans and actually make payroll. Some of them just shut their doors. They just couldn't prepare for that drastic loss in revenue. This was huge, and a lot of them just suffered because they weren't prepared. Not preparing for revenue loss in your practice means you are preparing to close your practice. So let me say that again. Not preparing for revenue loss in your business means you're preparing to close your business. This is just a fact. Warren Buffett, big time investor from Berkshire Hathaway, said, revenue is vanity, profit is sandy, and cash is king. You have to find new ways to bring in revenue for your practice when you're going to see drastic revenue changes. We'll talk about that next on how you can do that. So here's one action item for this section. You have to make up your mind today to do something about the coming revenue. I'll be honest with you. If you're not going to do anything, you might as well just turn off this video and move on. I'm really trying to give you some insight. As you can tell, I'm super passionate about this because I talk to practices all day, every day, and I see the pain they're in from staffing, revenue loss, new regulations, new technology. Don't be one of them. Think of ways you can grow your practice now so you don't be underwater when it comes to you. Build your boat now before the tidal wave comes. So that brings up the last, and that's basically invest in yourself. You have to invest in your skills and knowledge. Yes, you take continuing education units, CEUs every year to understand the latest medical information, but you have to understand the business of technology, business of growing revenue, so that you don't be left behind. This is some ways you can do it. I just talked about that one big beautiful bill, right? How it's going to decimate Medicaid. But in crisis, there's opportunity. Again, in crisis, there is opportunity. And in that bill, they also released what they call direct primary care opportunities. If you don't know, direct primary care or concierge medicine is a way for patients to pay into a medical membership service once a month and getting direct access to physicians, speedier responses, labs, things like that. This is a huge growth area. So for the first time ever, patients who have what they call high deductible health plans, so basically these are health plans that you have to meet a certain number, typically thousands of dollars before the health insurance kicks in. They're going to allow you to use your HSA, your health spending account, in order to pay into these membership plans, $150 a month or $300 a month if you're a family. This is a huge opportunity because now this is tax deductible money that can be used and has never been done before. And so if you are a primary care physician or healthcare provider, this is a perfect time to get in there now and offer your services to employer group, right? Because now they have incentive deductions, tax deductions to provide this type of service. And this is huge revenue opportunity. So again, bill decimated one area, but another area you have opportunity. There's other opportunities, right? Artificial intelligence, we just talked about that, but how can you use it in your practice today? Help your employees become more efficient using AI so that you don't have to hire more staff and you can cut your costs. Look at it to provide those ambient listen tools, right? So you can have it understand what you're saying, code for you automatically, but also have your notes there so you can reread them, understand exactly how to treat that patient. But there's also new service lines. I'm seeing practices get into clinical trials to grow revenue that way, or offering cosmetic services like Botox in order to kind of drive revenue. Think outside the box and you'll see there's new revenue opportunities all around. We talk about this all the time on this channel, but remote care as a service programs like RPM, CCM, those are opportunities to grow revenue. And guess what? This is a recurring revenue model. So that means it's consistent relatively over month, as long as the patients stay on the programs. So these are huge opportunities for you to build your boat before that tidal wave comes and ride the wave and not be taken under by it. So definitely do that. Jeff Bezos, huge entrepreneur, Amazon, said humans tend to overestimate risk and underestimate opportunity. As a physician, as someone who went to school for many years, myself included, I have multiple degrees. Sometimes we always see the downside, but guess what? The upside is so much better. So keep your focus on the upside. And to help you do that, below notes, if you're interested, I'm offering this free masterclass to join. We typically limit it, so it may be closed out now, but look, put your information in. Promise we'll reach out to you because we want to build a community of folks who are interested in learning how to look at the opportunity, how to invest in themselves, and how to grow their practice in this tidal wave that's going to try to take them under. So go check out below our masterclass. If you can get in, great. If not, please just sign your information. We'll promise we'll reach out to you because we want to help independent practices, other healthcare organizations that are looking to change for the new normal and not be taken under by it. So today I talked a little bit about the tech challenges that are coming in. We talked about the regulatory challenges, and we talked about how you can overcome this and build your own boat by investing in yourself and start building the skills now to withstand that and take advantage of the opportunity there before you. The time is now, so don't hesitate. Go ahead and make some action. Definitely check out some more videos to see what we can offer here. But in the comments below, please let me know what areas that you want to invest in your learning when it comes to how you're going to survive the new normal for the future.